All right, everybody, we are locked and loaded. This is great. We're going to get kicked off. Dr. Greene, first, before we start jumping into everybody's questions, I want you to tell folks a little bit about your own personal story, because you're such a unique doctor in that you too struggled with infertility. And in fact, you have a picture of your embryo behind you. Kick us off with a little bit about your personal path, not to even becoming an IVF doctor, but your own personal journey to IVF.
Sure. I've been in this profession since 1995. I've been doing IVF since that time. And, so I've actually seen a lot of changes that have gone on over the course of the many years. But what I think is really interesting is that, about halfway through my career, my wife and I decided kind of suddenly and late in the game that, we would like to have a child ourselves. And based upon just age-related issues that are very much related to egg quality and are essentially unavoidable based on everything we know today, we jumped right into the fertility process ourselves. And I learned a lot. I learned a lot as a patient, just like I've learned a lot every day as a provider. And to be honest with you, as you and I have discussed, I don't think it's changed the way I do things, but it's definitely made it a lot more personal.
Yeah.
One of the things that I deal with all the time is, in the early days of my career, things didn't work more often than they did. And we kind of expected that. We were almost planning the next try at the same time we were trying a treatment cycle. And, over the years, I've sort of worked with different groups and developed higher and higher success rates. And it's to the point now where we don't really celebrate the victories as much as we just suffer whenever we're not successful. And to be honest with you, I take it very personally. I try not to, but I think it's that passion and the caring that really brings an extra level of motivation to everything we do.
I completely get that. And one thing that I love so much about the personal stories when you've gone through it yourself is that you're bringing accurate empathy, and everyone can practice empathy, but you have an accurate empathy.
Yeah. And I like that terminology. I never really thought of it that way, but having been through it and been through it at a time and a place, because I wasn't working, at the place I'm working at now at the time we went through things, success rates just weren't as good as they were. And, when I was on the other side of the desk, I didn't like the way certain things were explained or told to me. And, sometimes I was told to do things that I didn't agree with. And, I'm a very data-driven guy. One of the things that I think a lot of people lose sight of in this world where, a lot of opinions tend to rule on a day-to-day basis is that beautiful thing about science is it's true even if you don't believe in it. And we're in a very data-driven and science-based field. So.
Yeah, absolutely. Well, your video quality has improved a lot, so people can see your embryo in the form of a newborn in the background. I love that image. It's so inspiring, and that's what we want to help everybody get to. So let's jump into a couple of questions here. And then I have some of my own questions that we'll jump back into. And I see some of our favorites. I see some folks that I recognize. It's so good to see repeaters come back. Does stress impact egg quality?
Well, first of all, let's start by defining stress. Stress is kind of an interesting term that's used like a lot of things that originally were used medically, and now it's everything, you can imagine. And as we understand it today, there's different types of stress. There's emotional stress, there's metabolic stress, there's physiologic stress, and so they're not all the same. And chronic stress is even different than acute stress. And certain degrees of stress can actually be helpful in limited amounts. But chronic stress tends to not be good for us in any way in terms of our health and wellness. What I mean by that, one of the things we're learning about different dietary patterns, for instance, is a dietary pattern that's becoming much more popular in the aging community is something that's called intermittent fasting. And this is where literally people, instead of eating, 3 meals a day plus 2 snacks plus dessert, which is what a lot of people tend to do, is that they, eat a more limited amount of hours in the day. Either they concentrate their calories in certain hours or go on the occasional fast. And this is a classic example because that's a nutritional form of stress. And if you do this intermittently, this can stimulate certain changes that can repair DNA, which is why this has been shown to be helpful in healthy aging. Now, understandably, one of the things that you and I have talked about is part of the reason I started focusing so much on egg quality is egg quality, I believe, is really the first real sign of aging. You know, everybody realizes that fertility peaks for women in their mid-20s, and they don't think of that change and decline as a sign of aging, but it really is the first sign of aging. Right. Long before you see wrinkles or graying of the hair, you see changes in egg quality.
Right. And that's the thing is we can't fight against that biology. There are things that we can do to address it outside of having babies when we're younger. Right. And that's why you have focused on it is, and then if you have both like an egg quality and a lower egg reserve, you know, I think to a lot of patients, Dr. Greene, that feels like the hardest hill to climb.
Mm-hmm. Well, and to be honest with you, I think we've made it even more challenging in our field. You know, the fact that 30 to 40% of people are still treated under an official diagnosis of unexplained infertility, you know, that kind of makes it implied to people that we don't really know what's going on. And
we hate that term. I know. It's a very frustrating term. Like all of us just really don't like that term. We need to rename it.
And I've got my answer for that too, Alice.
You do? Oh, what's the new name?
Unspecified infertility.
Oh, it's much better.
The reality is that infertility is diagnosed with a calendar.
Exactly. You know? Which is also frustrating though.
Which is also frustrating. But what happens is you do certain tests and often that eliminates certain reasons to explain it without often telling people exactly the reason it is. And we can talk about this, but the vast majority of these unspecified infertility issues are related primarily to egg quality, which is just impossible to measure except with the most, really involved techniques, which we're going to talk about, I'm sure.
Well, let's dive into those techniques because, we often say to patients, you don't really know your egg quality until you go to make an embryo.
That's exactly
and that's also incredibly frustrating. Well, because we wish that we could measure egg quality before the embryo stage because people want to optimize their egg quality before they even start to try to make an embryo.
Exactly. And let's put matters in a little bit of perspective, okay? Even a very, very fertile 25-year-old woman trying to conceive with a very fertile 25-year-old or comparable age man, if they're trying for 1 month, the 1 month pregnancy rate on average is about 25%. Easy to remember, 25. Now, the reason that that's so low is women are typically releasing 1 egg a month. And one of the things that we know from studies, for instance, with our very best egg donors, even the best egg donor, on average, about 1 out of every 3 to 4 eggs is a good egg. So on any month that someone's releasing a bad egg, they're not going to get pregnant. Doesn't matter if you do everything else perfect.
Right.
And on a month when there is a good egg, everything else still has to be perfect.
But it's possible that the 20 million, it's possible that the 20 million sperm that trying to get to that egg might also be bad. It's not all the egg's fault.
Exactly. And the point is when there is a good egg, even in the most fertile guys, about 1 out of every 15 sperm is a good sperm on average.
Wow.
So if a bad sperm hits that good egg first, then you're done that month. And even if it is a good egg and a good sperm, there's timing issues. And then even if the timing is perfect, there's implantation issues. And so the fact that there's so many factors at play, it makes it very clear. But as I said, we learned through the IVF process by doing genetic testing on eggs from egg donors. If people look today, anyone that's working with an egg donor, they're counseled they need about 6 to 8 eggs for every 1 or 2 babies they want to have.
Wow. Wow.
So you can understand that egg quality is always an issue, even for a fertile 25-year-old.
I think that is one of the most important things I've ever even heard you say, is egg quality is always an issue, even with the most fertile person. And if I want my listeners and our community and our audience members to have any takeaway from today, it's not your fault. It's nature.
Exactly.
It is not your fault. This is just nature, and it's inefficient. And also helps us really recognize the miracle that every single live birth truly is, whether it happened without assistance or with assistance, because so many things have to match up.
Exactly. And knowing that actually starts to explain why we use a calendar to diagnose fertility issues.
Exactly.
Because if we're dealing with just those standard parameters, is average egg quality, average chance of a good sperm, average chance of timing, within a certain number of months, things should line up. And if not, it means something else is going on.
So we have somebody, Frenchie Jen, and good to see you again, Frenchie. She's already been through a lot, and she hasn't done IVF, and a lot of people would like to avoid egg retrieval if possible, right? So she's done 4 IUIs. She's done HSG, she's done SIS, I'm not sure what CIS is, and blood work, and they can't find any reason it's not working. Frenchie, the sperm checked out fine, or using a donor? I don't recall that part of your story. So did all the sperm check out fine? Is there anything off there? What can she do to address egg quality so she herself can maybe rule out egg quality being part of the issue?
Well, first of all, the clarification, SIS is saline infused sonography. So that's what's called a sonohysterogram.
Got it.
And this gets back to exactly what I was saying a moment ago, is that people often want to know why they're not getting pregnant. And that's not really what's important. What's important, in my opinion, is focusing a goal on getting pregnant. In other words, it doesn't help to know the name of why you haven't been successful. And it's unknowable with today's science anyway. So what's more important is really focusing on what the goal is, which is to establish a pregnancy. And once you understand that, what I explain to people, the difference between different options, like trying at home with an ovulation kit, or doing ovulation induction, or doing ovulation induction with IUI, or doing IVF, the real way to think of it is you're controlling some variables, or more variables, or as many as science allows us to. And so what you're doing is you're basically just leaving less up to chance. Because anytime you're leaving certain elements up to chance, what happens is you might fail 1 month for one reason, and the next month for a different reason, and the third month for a different reason still. And you never.
That is really important to understand that.
Exactly. And the point is 1 month, Frenchie, you may have had a bad egg. The next month, it might have been a good egg and a bad sperm. The next month, it might have been a good egg and a good sperm, but the timing is off. And the problem is you can't control for, more variables unless you go to the next level. So you could definitely do some things to optimize egg quality and optimize sperm quality. And these are things everybody should do. And the reality is that many of these things are the things that we recommend in order to try to optimize not only the chance of getting pregnant, but also having a healthy pregnancy. I mean, one of the things that we hear too often is like someone that says, I'm going to stop smoking after I'm pregnant. It's like, you're not going to get pregnant if you don't stop smoking. Or you're going to get pregnant with a lower quality egg. And so the time to start all those healthy diet and lifestyle things is at least the 6 to 8 weeks leading up to when you're trying. One of the interesting things, Alice, is most people that have gone through fertility treatment, they can quote the fact that it takes a sperm about 90 days to mature. Interesting thing is it usually takes an egg between 120 to 160 days to mature.
Oh, wow.
And so if people only focus on the 2 weeks between ovulation and the menstrual cycle, That's like trying to focus on improving things your senior year, but ignoring all your rest of school, you know?
That's a great analogy.
It's
a little late. Yeah. So the fourth quarter of senior year and it's too
exactly.
late.
Don't leave it to the fourth quarter.
Yeah, exactly. You just said so many perfect sound bites and all of that. And I really want to make sure that we underscore it. Okay. That 120 to 190 days for an egg to mature.
120 to 160. That's correct. Yeah.
120 to 160. That's a long time, y'all.
Exactly.
So, I mean, that is like commit to 4 to 6 months of healthy improvements as you're going through this entire process, knowing that is going to have a direct result on the health of your eggs that you need at that time.
Yeah,
so what are some of your favorite things? Because people ask a lot about supplements. They ask a lot about DHEA, a lot about, the omegas. What are some of your favorite things that people can do in that 4 to 6 months of egg quality? Let's call it egg quality improvement time.
Well, one of the most important things to remember, and I remind myself and my fellow colleagues all the time, the reason we call supplements is they're supposed to improve an otherwise healthy diet. Now, the reality is in healthcare, we love things that look like they're in pill form, but the reality is if you're eating all the right foods, you have a very minimal need for supplements.
Sure.
So if you really try to focus on diet first, you can often get a lot of the healthy things you need to optimize egg quality, okay? But beyond that, it is sometimes hard to get all of the nutrients or to know who needs a little more of this versus that. But I think focusing on a healthy diet is the first and most important tip that people should be on. And there's a lot of different advice out there of what is the perfect diet. And I always tell people diet is more like our own individualized religion. We all sort of have our preferences. And we pick and choose the facts that support our own preferences, you know? But the reality is there are certain facts. And, trying to consume a mostly plant-based diet, you don't have to be completely vegetarian, but mostly plant-based is healthiest, okay? At the same time, trying to make organic choices when you can. And better still, trying to avoid things that have labels, trying to eat things when they're closest to their natural form, and beyond that, there are certain supplements that can be very, very helpful. Not everybody needs every supplement, but depending on someone's baseline diet and their baseline physiology, there are certain things that can be very helpful. Some of them like CoQ10, which, and it's always worth to sort of talk about these things in real world form so people can understand the why instead of just the what. CoQ10 is something that we naturally get in the dark leafy green vegetables. Okay. Now, most people are familiar with how important things like spinach and kale are, but not many people eat those things daily, let alone in the quantities sufficient to get the ideal amounts. So for a lot of people, something like a CoQ10 supplement can be helpful. But what that focuses on is optimizing the power cells of the egg, what are called the mitochondria. So it doesn't really affect the DNA like a lot of people think of, that affects the child, but it can affect the way the power cells and the DNA of the mitochondria work. And so that's really important.
Fascinating.
Yeah, exactly.
That is so important. One thing that I've been advocating for within our community is my cheat is just 4 cups of arugula every day. So I'm a very basic, boring eater because I just am like a little bit of a machine, right? I wake up, I don't want to think about it. I don't need a lot of variety, but I have 2 cups of arugula with my breakfast, and I have 2 cups in a soup for my lunch. And probably I should switch it up and have some kale and spinach sometimes, but I don't like to have to think about it.
Yeah, well, exactly. There you go. Exactly. Yeah. It's making good choices and using supplements, but using them wisely. Not every supplement is relevant for every person. For instance,
not everyone can even absorb a supplement the same, right? There's always like absorption issues.
Yep. Yeah. But like a classic example, as you mentioned, DHEA. DHEA, as I always explain to people today, is sort of the poor person's version of testosterone. You're giving a hormone precursor called DHEA
I see.
and hoping that a woman's ovary is going to make it into testosterone. Now, first of all, for most of the people that have real egg quality issues, they don't make that conversion very efficiently.
Right.
So, sometimes people could be taking DHEA and their body can't convert it anyway. Worse still is for some people, like women with PCOS, they might have too much testosterone, and this is going to be adding like fuel to a fire.
Right.
So, they usually would do much worse if they took DHEA. So it's a classic example of how there isn't one universal recommendation that you could say everybody should do beyond some of the basic vitamins, that we all need in certain amounts.
Right, like vitamin D.
Vitamin D is critical. And vitamin D is a classic example. I remind people of this every day, Alice. Vitamin D is technically not a vitamin.
I know, it's a hormone.
It's a hormone.
I wish we would rename that too.
And, I tell people that, it's a hormone that humans have made in their skin for thousands of years. But ever since we started wearing clothes and living indoors, we don't make enough of it.
We don't.
And vitamin D is very critical for its ability to influence egg quality.
Yes.
And interestingly enough, most people look at the vitamin D recommendations, which include the minimal amount that's recommended to have strong bones. And, the way the orthopedists think is they want to see at least 30 nanograms per ml.
Right.
But ironically, fertility is optimized at a 40 to 60 range. That's where we see pregnancy rates are highest and miscarriage rates are lowest.
Oh, I didn't even know that. I'm learning so much in just one chat, and I've talked to you before. So interestingly, when I was diagnosed with breast cancer, Dr. Greene, my vitamin D level was a 6.
Yes.
6.
And that's very common as well.
So common. And then I worked to get it up to a 30. And then during the pandemic, I was like, I feel like I want it to be higher than that. And I worked to get it up to a 45. But it is something that I do routinely check in on to see that it's trending in the right direction, where I feel it's more protective, and as I'm hopefully heading into another embryo transfer myself in about 4 to 6 months, that I have enough to facilitate that transfer, to be successful as well.
Yeah. And the reality is, again, it's no disrespect to the orthopedist, but instead of thinking about what's the minimal, we should think what's optimal.
Yeah,
we see a lower risk of death from all causes in that 40 to 60 range.
Yes, exactly.
It actually improves the way your immune function works. Exactly. Believe it or not, Johns Hopkins even recommends getting in the 40 to 60 range to minimize the risk of COVID-19 infection.
Yes, that's right.
So, the reality is there's many health benefits to getting into that 40 to 60 range.
Absolutely. So that's huge, everybody. Or D, and we always advocate, Dr. Greene, do you agree with us advocating for D3 and not D2? So it's already activated.
Correct.
Yeah.
Yes.
So D3, not D true. Okay. Some more great questions coming in. Does embryo grade play a role in embryo quality? Is grading really a quality metric?
Yeah, first of all, and I actually just recently recorded about a 30-minute video blog explaining embryo grading. One of the sad realities is embryo grading, most people, I should say, not everybody, but over 90% of centers use the same embryo grading criteria that have not been revised in 20 years, okay?
Wow.
And the reason
so much scientific evolution, but not so much on that side.
Exactly. And the point is, embryo grading it creates a common language. So that if your embryo is graded at our center or someone across the city or even across the country, if they're using the same grading system, they all, know what they need to know about the embryo. It's like a shorthand. Right. So it doesn't really estimate quality, but within each lab, you're able to see how the grading correlates with the chance of implantation. Interestingly enough, and I actually proved this in a paper many years ago, sometimes the highest grade embryos are so genetically abnormal, there's no way they could implant. or
Wow.
result in a live birth.
Right.
So again, if DNA or if live birth is a measure of quality, then there isn't really quality, in grading. But it is predictive of their ability to implant. But
Right.
ironically,
Isn't necessarily which does not, that's an important consideration though. It's not predictive of live birth.
It's not even predictive of pregnancy.
Exactly.
I can tell you that I've seen many AA embryos, which is the highest grade, that could never implant.
Sure.
It's physiologically impossible because of their DNA.
My AA didn't implant, but whatever my second level was with my not as fully hatched embryo is my 7-year-old. And I'll never forget that. We had like the fully hatched embryo, perfect looking. She's probably going to make it. And then, 26 weeks later, they were like, nope, it was a boy.
Yeah. And the important thing is again, the power of words, Alice.
Right.
Grading is an estimation of the chance of implantation.
Right.
Just like someone's grade in school is an estimation of how successful they'll be in their career. But sometimes the person that has a C average or drops out is the best employee you ever had.
Exactly. I mean,
whereas
we've heard that
is dysfunctional.
Completely. That's so true. That's so true. Your analogies
is only
are great.
An estimation, and it's very subjective.
Yeah, got it. Okay, let's talk about human growth hormone. How do you use it? Do you give it before stims, during? Does it apply to every cycle? How do you choose?
Yeah. Again, not one easy answer, okay? First of all, let's talk about human growth hormone just for a minute, okay? So people can understand the what.
Yeah.
Human growth hormone is sort of the yin and the yang versus insulin, okay? Insulin lowers blood sugar when blood sugar is high, okay? Growth hormone raises blood sugar when blood sugar is low. Okay. And this is why things that naturally cause growth hormone to be released are things like exercise, which is good because it stimulates growth hormone release and various other things. Sleep is when we release a lot of growth hormone because we're not eating then. So this is what makes it so you don't get low blood sugar in the middle of the night. Okay. Wow. And I mentioned a moment ago, intermittent fasting. By waiting and not eating anything after dinner and then maybe eating a later lunch, that stimulates growth hormone release. So there's certain ways that you could improve your own ability to release growth hormone, okay? And growth hormone does various different things. It can improve egg quality. It can stimulate certain repair of DNA. It can also make the cells, function metabolically more efficiently. That being said, growth hormone is one of the things we produce less and less of as we age naturally, okay? And so it can definitely be beneficial in optimizing egg quality for women, that are going through fertility treatment to optimize egg quality.
In a certain age demographic or all ages?
Well, again, just like we all know of that healthy, 42-year-old that conceived naturally, whereas someone that's in their early 30s that's not able to get pregnant, and has a very low ovarian reserve. It's the difference between physiologic age and chronologic age. What's important first is always go into the diet and lifestyle first, okay? Sure. But the problem is growth hormone works very, very well in people that need it. It's very safe when it's used properly, but unfortunately, it's also very expensive. And so if you're using a treatment that has kind of a difficult area to measure how much it impacts success rate, like IUI, I've never seen a study showing growth hormone improving the pregnancy rates for IUI. Doesn't mean it can't work. It just might be that it helps by a couple of percentage points. And so you have to look at benefit versus cost. Of course. Whereas in IVF cycles, if you suspect a low egg quality, either based on previous IVF cycles, or if you have seen bad outcomes or low ovarian reserve, these are situations that it can clearly be beneficial. We also find that some women with a history of endometriosis tend to do much better if you include human growth hormone, especially if their endometriosis is significant enough that they also have a lower ovarian reserve.
Got
So,
it. Okay. Very helpful.
Now, we're also finding now more recently that human growth hormone can also be very beneficial in promoting implantation. So for women sometimes that are going through frozen embryo transfer, and this is maybe even personal information, we're often, including that in people that do their egg retrieval 1 month and are doing their embryo transfer months or years later.
Wow.
And there have been some great studies showing this can really augment implantation for similar but different reasons than it can improve egg quality.
That's amazing. That's the first time I've actually heard about that study, and we will include links to studies for everybody because Dr. Greene is giving us so much incredible information. Now, when someone is going to take like a D3 supplement or some other supplements that they feel compelled to, I'm on a prophylactic anti-COVID regime myself. Do you have a favorite brand? Is there a brand that is higher quality that you've noticed than others?
I usually don't like to recommend brands because oftentimes a lot of manufacturers don't have specific quality controls in place. Right. One brand that I think is very good because they do pay an independent agency to monitor the control. There's a product put out now called Fertility.
We talk about that one a lot on here.
Yeah, I mean, that's the manufacturer's name, but they've got a product called Theravir. The Theravir product has the vitamin D in there, has quercetin, a little extra vitamin C, vitamin E, as well as melatonin. Melatonin is an underappreciated hero.
I'm so glad you brought up melatonin because I am a huge advocate of melatonin. I was going to ask you about that one. Everybody should go melatonin, right?
Yeah, I mean, and to be honest with you, Alice, I was lecturing about melatonin at the National Sleep Foundation meeting 10 years ago. Okay?
Get out. Oh my gosh.
And melatonin is something that our brain releases during healthy sleep. And again, healthy sleep, means that not only are we asleep, but our body is doing all the things during sleep we're supposed to do.
Yes.
When people artificially induce sleep with a sleeping pill, that's anesthesia. That's not really healthy sleep.
No, it's not. I know. And we talked about it so much, even in like the pandemic year, just to reduce people's stress level.
Exactly. And again, there's that word stress again.
Exactly.
If people are sleeping well, then they're not going to release melatonin. Frequent wakening, exposure to light, these are all things that reduce melatonin.
Yeah.
Fascinating data has shown that if you measure the amount of melatonin in the fluid that surrounds each egg is in a separate follicle surrounded by fluid. There's a really high correlation between the concentration of melatonin in the follicular fluid and egg quality.
Oh my gosh, I had no idea.
And the amount of melatonin in the follicular fluid tends to be about 5 to 6, times higher than what you're able to measure in the bloodstream. So, the ovaries concentrate this hormone. And so this is something that nobody could really tell how much melatonin you're making unless they come into your house and wake you up in the middle of the night and measure it. So it's one of the things that you could recommend to everybody, but here's a real kicker on talking about supplements. This is one of those situations you want to avoid anything that's labeled as natural, because natural melatonin comes from cow brain. And people have heard of mad cow disease, and this is why, no one should be taking anything that's derived from cow brain. And so natural melatonin is not something someone should be taking in a supplement form.
Oh my God.
You want a synthetic bioidentical formulation that isn't going to have any microscopic structures called prions in it that can give you something very unhealthy along with the healthy supplement.
All right, I'm about to go get my bottle right now and look at the label, make sure I didn't buy the wrong one. I've had my son.
If it says natural or bovine, you should not use it.
Okay, no go on that. I mean, so much of reproductive medicine started in bovines, but we shouldn't be ingesting that in our supplements. Makes a lot of sense.
Exactly.
Heather and her wife are headed into their third IUI. So obviously the first two didn't work. Yeah. What are some things when you have patients that are committed to doing 6 IUIs before moving on to IVF, what are some of the things that you can optimize in between IUI cycles?
Yeah, well, again, focusing on healthy diet and healthy lifestyle is really, really critical.
Most important.
You know, but one of the things that we've learned, and this is something that Heather should focus on for a bit of optimism, is, one of the things that we've been learning through what we call duo-stim cycles with IVF is that if someone does, back-to-back stimulations, we often see sequentially better quality eggs in subsequent cycles. And again, this goes back to what we were saying a couple of moments ago, that 120 to 160 days. So even though, Heather may have gone through 2 failed IUI cycles, she may have primed her egg quality to be even better in the coming month.
That gives me a lot of optimism. I love that.
Definitely keep, stay on the positive, do the things that she could do, focus on diet and lifestyle, and see what things she might be able to do to even further boost the odds if she's really committed to pursuing things. But at the same time, again, you gave me a great term. I'm going to give one to you that a patient shared with me, active hope. Okay.
Oh, I love that.
And another one of my favorites, through the whole pandemic, stubborn optimism. Okay.
That's fantastic. I love that. That's what it requires, right? To go down this journey. It requires that. You have to have a level of stick-to-itness.
Absolutely.
You can't stick to it if you aren't trusting the body. I think that the game changer in today's conversation for me is actually connecting those dots on 120 to 160 days for egg quality to hit its prime. If you're making all these commitments and eating those green leafy vegetables, and it's track it. I know when I was recovering from cancer, I was texting with a cancer survivor today, and she was so frustrated because 4 or 5 months after surgery, she still has chronic fatigue and no energy. And I told her what I did. I said, look, I tracked from the beginning if I could just walk to the bathroom, without going back to bed. And then I tracked, could I walk just to my block outside the house before going back to bed? Then could I walk to the stop sign? Could I walk half a block, right? And it's the same thing on the fertility journey. If we can track our progress so that we celebrate our commitment to ourselves and our commitment to a healthy baby. And we say, through Fertility Answers, that our collective community is committed to helping people give birth to 1 million healthy babies. And you're part of that community, Dr. Greene. So all your advice is so incredibly important about these things, about eating those leafy greens. So Heather, it's commit with your wife on this front, with track it if you need to keep yourselves motivated. I did it on a little Excel spreadsheet and I printed it out. So it was on the refrigerator and I could check off okay, I met that goal today. I drank the water I was supposed to drink. I took my melatonin, maybe my CoQ10 if I felt like I needed it. There's another supplement people ask about all the time, Dr. Greene. It's NAC. And it looks like Maria joined on a little bit later in the show. I'm asking again about CoQ10. What about NAC? Because we have a naturopath fertility specialist who has talked to us a lot about NAC.
Yeah, and I would have to defer to that person because in the reproductive endocrine literature, there is really no good data supporting it, and there's no good data refuting it either. So in the absence of data, I can't and shouldn't and respectfully won't comment on it. It's not something I recommend to my patients because the way I look at it is we all have limited resources, and I always hold myself up to scrutiny. And if someone says, what are you basing it on? I'm willing to put it on the table. And I just don't have it for that. But one thing you said a moment ago that I just want to build on a little bit, because we've mentioned stress a couple of times, and you've mentioned cancer a couple of times. One of the things that I think we don't talk about often enough is meditation. It kind of blows my mind that meditation has become part of mainstream cancer treatment. It's become part of mainstream of cardiac rehabilitation.
That's right.
It's become part of mainstream neurologic recovery from stroke and brain injury. And there's great science of its benefit in reproductive medicine, and it does not get talked about. And the reality is we're understanding today that when people take up a very simple meditation practice, long before they ever feel like they've mastered it or gotten good at it, they start getting almost immediate benefits that are measurable.
That's
And,
right.
you know, we've looked at this scientifically, and you can see improvements in what's called telomerase, which is an enzyme
Yes.
that stimulates DNA repair. And
Yes.
so this is why we see recovery from all these other things. And in what area could DNA possibly be more important than reproductive medicine?
That's exactly right. Which is
So I
that's such a
strongly
great
encourage
point.
people to take up a meditation practice.
And we have on the app, if you're a registered user, you've already been matched to a specific fertility meditation app. It's free. And you've already been matched to it and use it. I do a 10 to 15 minute daily meditation practice myself.
Me too. I'm in there every day.
Even if I can't sleep after taking my melatonin, there's a sleep meditation that sometimes I have to listen to 3 times in one night. I'll fall asleep, wake back up, listen to it again. And, you know, and it's through, I always forget. I always want to call it Upwork, and it's not. It's Unplug.
Yeah.
It's Unplug. And that's another, I mean, it's phenomenal because they kind of go topically. Sometimes what we do team meditations, even with our whole team on Zoom, I just hold up like an abundance meditation, but you're so right. And I love that you're a doctor advocating for meditation, you know,
because there's great science behind it, Alice, and people don't talk about it.
I know. What I like to do is put my meditations on speaker so my 7-year-old can hear them.
Yep.
Because I just feel like eventually I'm going to invite him, you know, one of these days he's going to say, yes, I'll do it with you. He keeps resisting, but at least I keep inviting. So that fantastic advice on that. And that leads right into Crystal's question or sort of comment. She's transferred genetically tested embryos that have not resulted in a pregnancy. And she moved to a new doctor that advises against genetic testing. Now, there's 2 parts of this that I kind of want to discuss with you. One, you and I've already talked about in the past privately, which is we see when people start jumping kind of from doctor to doctor to doctor during those failures or from clinic to clinic, they become very confused, and it ends up taking them longer to see success.
Yeah.
Right. Because now you have 2 and that happened to me with oncology. I had 2 competing opinions, and I got them on the phone to kind of debate their opinion with each other. So I think I want to address this concept of some clinics are like, you know, are against genetic testing. Some are for genetic testing. Some have conversations to weigh the pros and the cons of genetic testing. You know, that must be a really confusing situation for her and her partner to go, okay, well, now they're worried maybe the genetic testing, you know, was the point of failure, you know, or are they supposed to transfer day 3 embryos? You know, is there anything that we could do to just guide her own decision making as, you know, she considers, you know, the next cycle?
Well, as I mentioned a couple of times, in the scientific field, we should always be willing to put data on the table, okay? And we should always be able to, in other words, there's theories and then there are facts, okay?
Right.
And you could have whatever theory you want, but if the facts say something else, then you're practicing on belief rather than on data, okay? And so, you know, bottom line is that each person should make the decision independently. What I try to offer people, and I'm big on doing whatever is appropriate to provide, number one, the highest success rate possible, okay? Number 2 is anytime we fail at number 1, what do we learn from the process?
Right. The first one is so important to learn.
Exactly. If you don't learn anything, then the next time you're just guessing again. And, you know, and it's almost like IUI. You could fail 1 month because the embryo didn't make it to the blastocyst state.
Right.
You might fail the next month because it made it, but it wasn't normal. And you might fail the next transfer because it made it and it was normal, but it didn't implant. Right. And so if you never know what's going wrong, you never know what to do differently if you're not successful.
Right.
And the reality is when you look at all the data, like I still see today people that advocate day 3 transfers instead of day 5. There's never been a study that showed better outcome with day 3 transfers. So if someone doesn't recommend, you know, a blastocyst transfer, chances are their lab can't grow good embryos.
Right.
You know, there's never been a study showing a lower implantation rate with genetically tested embryos than higher. Right. So if someone's advocating for that, maybe they're not good at testing embryos. And if they're going to damage an embryo, then you're better off not having them tested.
Yeah,
you know?
exactly.
And so it's a matter of putting data on the table, but also respecting people's individual opinions. I have patients that say, you know what? If an embryo is abnormal, that's my fate, and I don't want to test it. I respect that.
Yes.
But then they can't ask me for a definitive answer about why a cycle didn't work because
you don't have all the
started
data.
with less data.
Exactly. And Crystal, if you want to talk some of this through, we have fertility advocates that are free for you to talk through. I still talk to patients on a day-to-day basis myself, and we have 3 others who do it as well. So feel free to reach out in our DMs and we can connect you. I'd be happy to chat about that. I will say that we see this over and over when people start switching clinics because of the failures, rather than staying put and kind of, working alongside a provider who's going to optimize for them. We do see it take longer to achieve success. And I don't know what the studies are that look at that, but I think that clinics sometimes, Dr. Greene, are very bad, and I mean very bad sometimes, at truly informing patients in advance that 2/3 of the time that first cycle is going to fail. And we need to set them up so that they can psychologically and emotionally and mentally be prepared for, okay, I'm picking this clinic and I'm going to give this clinic my 3 cycles because that's the average, but I have 7 in me, or whatever that number is. I like people to try to think through that in advance before they start it at all. So that they have kind of a mental toughness heading into it. And I think that clinics are scared about that sometimes. I think that they're scared to say the truth because they don't want the patient to walk away or be demoralized.
Similarly, though, when we talk about issues like egg quality, which is our topic today, looking and see how an egg performs in a high quality lab is the real test of egg quality.
Right. That's
For instance, if we fertilize, 6 eggs from a good egg donor, usually 5 or all 6 will fertilize. Okay. Right. And if someone, is being, has their eggs treated in the same lab and they only have 1 or 2 fertilized, that's a first sign of egg quality.
Really good point.
A second thing that's important is the way an embryo develops the first 3 days in the lab is intimately related to the egg quality. And then how well the embryo goes from day 3 to the blastocyst stage is more of an indication of sperm quality. So if embryos look great on day 3, but then they stop growing, then you've got a sperm issue that you couldn't know any other way. And if you put those embryos in on day 3, you never know you've got a sperm problem.
Right, exactly. Oh my gosh, this is such great information. We're just about out of time, everybody, but there are a couple of other questions just coming in. Is there, do you have a hard stance on like dairy-free or gluten-free when it comes to egg quality?
Yeah, in terms of gluten-free, gluten is only problematic for people that have gluten intolerance. It's never been shown to be problematic for people that tolerate gluten, which is over 85% of the population. In fact, for many people, it's a very efficient form of protein. Okay. Right. In terms of dairy-free, I'm vegetarian, and we've discussed this. I've been vegetarian since 1995. But I also acknowledge that dairy is not as good for me as going vegan. And so I deliberately try to decrease the amount of dairy that I consume, but it's okay to have some. But it's a classic example of trying to seek, more organic forms when you can. Right. Because again, a lot of the non-dairy or non-organic dairy products use a lot of bovine growth hormone to try to boost the milk production of the cows. And a lot of that milk appeared, you could test it and get a lot of the unhealthy growth hormone into your diet at a time when it might not be helpful. So, the bottom line is dairy is good if you tolerate it, but again, moderation. This is why I said a plant-based diet. But gluten is really only an issue for people that have gluten intolerance.
That's super helpful. What about the occasional glass of wine?
Wine is something that I've talked about recently. wine, coffee, tea, a lot of these things have been villainized because of one of their ingredients when each one of these is part of more complex solutions. Wine actually has a very potent ingredient called resveratrol in there, especially red wine. And this is a very potent chemical that's been shown to help optimize egg quality. It's also been shown to help lower stress hormones. So wine in moderation can actually have health benefits. Just like, people often ask about caffeine in coffee. Caffeine tablets aren't really a very good thing for you. But green tea or occasional coffee actually has a lot of polyphenols and different chemicals in there that actually have a lot of health benefits to optimize egg quality and pregnancy. So, again, it's moderation, and it's also making mindful, food choices. Think about what you're consuming and try to consume in moderation and the best version of that thing that you're consuming. And when you eat mindfully, you also enjoy it more.
You do. I like how you went the what and the why today. And it's the same thing with your food. What am I eating and why am I eating it?
Yeah.
And does this nourish me? Does this improve my egg quality? Does this set me up for vitality and wellness? Or does this harm me?
Exactly.
Yeah. There's some more questions coming in, and unfortunately we are out of time, and there's like 20 more questions. Oh my gosh. We only booked Dr. Greene for an hour. I want you to save your questions though. Dr. Greene is active in the Fertility Answers app. You can ask some of these questions. You can ask all these questions there. I think that Dr. Greene, Dr. Greene, one of the gifts you are to the world is your ability to explain things in a motivating, actionable, and clear way. So I just want to thank you for being so inspiring and so educational. This was fantastic. We have to do it again. And I mean, truly, we have so many other questions, and you guys know we hate running out of time. So, check our calendar so that you can join at the start of these episodes. It always takes like 10 minutes for people to start warming up to the questions they can ask, but we don't like running out of time. We're here for you. Find us on the iOS app and the Android app. Find us in direct message, and we'll be back on another Instagram Live to address all your questions Monday, Tuesdays, and lately Wednesdays and Thursdays. Dr. Greene, thank you. I can't wait to do this again.
And remain stubbornly optimistic.
Stubbornly optimistic. I love it. Will do. Bye, everybody.
Bye now.